Good morning, everyone. This is Mavra Agarwal. I'm a physician with the Florida chapter of American Academy of Pediatrics. Today we will be talking about Hurricane Ready Florida, promoting disaster preparedness for children and youth with special health care needs, with a focus on electricity and ventilator-dependent patients. This work is done in collaboration with Michelle Blanco, Marissa Colares, and Jennifer Takagishi, all and is supported by the American Academy of Pediatrics Pediatric Disaster Preparedness Grant. The learning objectives for our presentation today are to understand the definition of children and youth with special healthcare needs, to identify the various types of disasters, hurricane categories, and tropical storms that may affect Floridians, the review of different types of electricity-dependent medical equipment and corresponding medical diagnoses, identify at least 3 strategies, as well as resources to help families prepare for hurricanes in the clinical setting, and understand services available through managed care organizations, local, state, and national organizations. We have a great presentation for you today. First, we're going to give you some background information. Next, we'll also have a visit with a family with a child with special healthcare needs who requires electricity for the function of the medical equipment that he relies on, as well as a presentation by a managed care organization on what is available through Children's Medical Services and Sunshine Health. Thank you. So with that, we will begin. So special healthcare needs definition and epidemiology. Children and youth with special healthcare needs are those who have one or more chronic physical, developmental, behavioral, or emotional conditions and requires health and related services of a type or amount beyond that is generally required by children. Special needs may necessitate specialized healthcare services, accommodations in school, and specific family support. This definition is by the Centers for Disease Control. According to them, there are approximately 14 million children under the age of 18 years who have a special health care need in the United States. 25% of homes homes have a child with a special health care need, and these children are more likely to live in poverty, be non-Hispanic, Blacks, and have public insurance rather than as compared to children without special health care. Electricity and ventilator dependent children are those who require medical equipment or supplies on a daily basis that is dependent on electricity in order to function. So let's discuss a little bit about the types of disasters. You can have natural disasters such as those that affect Florida, so hurricanes, floods. You can also have wildfires and tornadoes that we see more out west, as well as earthquakes, tsunamis, or extreme heat. There are also man-made disasters, right? There's industrial accidents, nuclear accidents, chemical spills that we've unfortunately seen a few of in these recent months. And then there are biological events such as COVID pandemic and others. You can also have civil disturbances such as riots, terrorist attacks, or warfare. These are less predictable than natural or man-made disasters, but they are still important to consider in disaster preparedness planning. There's also can be infrastructure failure that can lead to a disaster, and that involves events like power outages, water supply shortages, a breakdown of communication networks, and so forth. And then finally, mass casualty incidents. And these include mass shootings, plane crashes, and so forth. So these are the general types of disasters. In Florida, we are, of course, much more prone to have hurricanes and tropical storms, as well as flooding. So this is a brief overview of the types of the categories of hurricanes. And as you can see, this tropical depression is something less than 38 miles per hour winds. Tropical storms are 39 to 73, and then a category 1 hurricane starts at 74 miles per hour, which is pretty significant. And recall that the hurricane season in Florida lasts from June 1 until November 30th. So what is the impact of disasters on children and youth with special health care needs? Health, well, first of all, there's disruption in healthcare, right? They cannot get the normal services, the healthcare services that they so often vitally rely on, much more so than typical patients. Secondly, there is the medical equipment. So uh, individuals with special needs, and especially those that require medical equipment, often require electricity as well, and they may find it difficult to use their medical equipment during power or outages that may occur with hurricanes and other disasters. There's also a challenge with access to medications, right? If they run out of or have are in short supply of a medication, that may pose a challenge as well. Evacuation challenges. Many families find it very difficult to leave their homes, very difficult. And so because of the challenges with mobility, because of challenges with finding a place, a shelter that can help house them, as well as having the support needed at the facility. Finally, evacuation challenges can also be finding a place or a shelter that is able to accommodate the entire family, especially if there are other children in the home. Disasters can also cause significant psychological stress on individuals with special health care needs, oftentimes because they do not understand why there's a change in routine, why there's a change in environment, and so forth. And so this is very distressing for many individuals. And finally, communication difficulties, right? Many of our individuals have challenges with communicating, and they are unable to express their needs, their anxiety, and so forth. Finally, if there is an environmental hazard, such as some, poor air quality, contaminated water, and whatnot, oftentimes these individuals have greater challenges because of the underlying health conditions.
Hi, my name is Michelle Blanco. I'm a pediatrician at the University of South Florida in Tampa, Florida. I work in our pediatric medically complex clinic. And today I have the privilege of interviewing one of our families. This is an effort through the Florida chapter of the AAP to promote awareness for disaster planning for pediatric medically complex children. And so today I'm joined here by Diana, who's the mom of one of our precious little ones. And she has graciously agreed to answer some of our questions for us. So thank you so much, Diana, for joining us today.
Of course, it's wonderful to be able to try to help everyone because I know a lot of information that sometimes we don't know, and I've been through that before, so I can only try to help other families. So yes, thank you for asking me.
We appreciate it. So we're just going to start from the very beginning. So your son, Quentin, when did you guys find out about his diagnosis, and what was his diagnosis?
So I didn't find out about Quentin's diagnosis until I went in for it was my 7-month anatomy scan. I was considered high risk due to my age, so I had this extra anatomy scan that was going to be done right around 7 months. I went in, and that's when the doctor noticed there was a mass around his neck. He didn't know, he couldn't give me a diagnosis, but it was a concern. At that point, I was informed that I would have to go or be transferred to what would be a high risk OB office, which would end up being the team at TGH. Once Quentin was born, what they discovered that mass was actually a lymphatic malformation, and it was creating pressure on his breathing way. So basically, the lymphatic malformation is his lymphatic system just never properly developed, which then kind of got backed up and created these fluid-filled cysts, which created these masses around his like neck, airway, and cheeks. So once we found out all about that, everything was a very planned delivery. I was going in often to get monitored. Baby was getting monitored in a series of tests and MRIs and things like that to prepare for Quentin's delivery because the mass was so large he couldn't be delivered normally. So yeah.
Yes, you guys went through a lot from the very beginning. And so
Yes.
can you tell me a little bit about his delivery and your NICU experience? How long were you guys in the NICU for?
So the delivery experience, this was my third baby. Obviously very different from my other two. My other two were super easy breezy. This one was a very planned delivery. Like I said, I was being monitored. I was going at least twice a week. And I knew the most important thing was I could not go into labor. He wouldn't be able to survive like a natural childbirth. So it was a scheduled C-section. Um, it was very scary, definitely, but my team was always keeping me informed. The doctors were always keeping me informed. Any issues that would arise, they would tell me, okay, this is the issue we've run into, but we're working on it. So I had full confidence in them the whole time. I had an amazing case coordinator through TGH, and as well, she was there for me 24/7. She was there for me during my appointments, during when I had my C-section, and even after. As far as the NICU, again, I'd never been in the NICU. I didn't know much about the NICU. But what I would have to say about it now was it was a wonderful experience. We were there for 4 months. Quentin was there for 4 months. And those 4 months, they really became like our family. It was baby, my husband, and our care team, because that's the only people that were allowed to be with Quentin. We weren't allowed visitors. So my experience with the NICU at TGH was just wonderful.
And I know that you guys and Quentin went through a lot during those 4 months. He was such a tough little baby. So maybe you can tell me a little bit about towards the end of his NICU stay, what sort of adaptive technology was he dependent on? And then how was that discharge and transition home? When you guys got home, what sort of equipment were you guys having to manage and know about? It was a big learning curve for you guys as well, I know.
Yes, it was definitely a big learning curve. Obviously, they gave us a date on when they would like to start discharging Quentin so that we would kind of all be on the same page. And we did have like training. I had to stay a certain amount of days in the hospital and start doing what they called our cares, which is the things that we would do for Quentin once we were home. In preparation for that, our machines were being delivered. We're being reviewed on how those machines would work at home. The week of discharge, I was at a loss. I was like, I don't know. I'm going to have to do all this on my own. I'm not going to have a nurse. Like at the hospital, something happens, they come in and they helped me. But they really, truly did prepare me. Even though it was very scary, I felt confident in all the knowledge that they had given me. And again, because of all the stuff that they made me or encouraged me to do there, I knew I had full confidence in my husband and I that we would be able to tackle any emergencies at home. He came home obviously with a trach, which he currently still has. He's had that for a little over 2 years now, a G tube and a G tube feeding. So came home with a vent, which he would use at night. Oxygen is needed. Like I said, the feeding machine, just things that would in the event of an emergency, such as like an extra trach, things like that, is what we came home with. We did come home on an ambulance that day. And for the first couple months, we did use that service just because we didn't feel too comfortable. And then little by little, we started taking short trips here and there with him to kind of build that confidence to be able to travel around with him as a family, because we do have 2 other kids. So.
Yes, no, I remember you guys became experts very quickly. And yeah, so with Quentin's cystic hygroma, you guys had come home, like you said, with the tracheostomy tube, on a ventilator, with a
Yes.
G tube and a feeding pump.
Yes.
So a lot of equipment.
A lot of
Juggle and to manage, and a lot of equipment that relied on a power source as well.
Yeah.
So in all of your planning, like you said, transportation to and from appointments and even at home, I'm sure that was tricky to always make sure you had a reliable source of power. And so that kind of leads me into the next part of our discussion, which is preparing specifically here in Florida for hurricane season. So being that we live in Florida and in the summer months, early fall, that's always something in the back of our minds. And something that we're trying to improve is how we can help our families prepare ahead of time for a potential hurricane. So in Tampa in 2021, we had Hurricane Elsa, and in 2022, we had Ian. And so that was right in the midst of you guys getting home, trying to figure out how to manage all of Quentin's care. And so I'm very curious to hear how you guys, on top of everything else, prepared for that. So I know that some families plan on just evacuating in the event of a hurricane coming. And so is that something that you guys considered with the hurricanes that have come by the last couple of years? What were some of the obstacles maybe that prevented you guys from thinking about evacuating? Is that something you guys discussed?
So yes, as you mentioned, 2021, we just come home March, right when hurricane season starts. We had just started getting very comfortable with Quentin's care, and then we're told what we have to plan in case of an emergency. So I was just at a loss, but luckily your office and other people gave me a lot of wonderful information. That particular year, we were told we could evacuate. We didn't evacuate. We decided to stay home. Because again, of the fear of the unknown with Quentin. We didn't want to go somewhere too far. Something happened to him, be far away from doctors, the hospital that usually would treat him, and most importantly, because we do have our two kids, where we would leave them if we did have to evacuate. So it was a major stress. It was a major concern. We did decide to stay home. And basically, what I did is I called around a hospital, where he was born at Tampa General, and I established him there in the event of an emergency, and we just were not able to take care of him here. Then that's where we would go, and that way I knew that I was close to my family, my kids, my husband, but they weren't too far away from me. In the event of an emergency that my husband had to come, we had family that could keep the girls or help us. Versus if we ended up evacuating, that wouldn't have been as easily done.
Yeah, you made a lot of great points.
The same thing with the shelter. I know they did offer that to us, last year and this year or this past year. But even that was a little unknown because I didn't know how that worked. I've never been to one. And again, it just all came back to, will we be together as a family of five, or would we have to be separated? To be alone with Quentin, all his machines, and a shelter with other people without my family, again, was something just very hard for us to manage.
And I think that's something a lot of our families struggle with, having multiple children and wanting to make sure that everybody is accounted for. And I think luckily, within our system, we have a large general hospital that can shelter some of our patients. But that might not be the case for everyone everywhere. And so you mentioned too, the Department of Health, the medical shelters, which I think is another option that a lot of families have to consider. So it's interesting right now in Hillsborough, our Department of Health is currently not sheltering during storms ventilated patients, which luckily there are not too many kids dependent on ventilators. However, this would have been a situation that would have been difficult for you guys if you weren't able to find a hospital that would have taken you guys in. And so another question that sometimes comes up, and I was wondering if maybe that was something your family had discussed as well, is finding a source of power at home in case the electricity goes out. So I know that a lot of the machines can sometimes run on backup batteries, although those can be short-lived.
Yes.
Or something like buying a generator, which can be tricky as well because they run on different types of fuel, and learning and managing that whole aspect of it. So did you and your husband consider a generator or stocking up on batteries for your equipment?
So we definitely did stock up a lot on backup batteries for our vent. We have about 4 of them currently now, backup batteries that we make sure to always keep charged. But yeah, the first year we were out of electricity for a while. We did not have a generator, but luckily we were able to, get some help from around other neighbors. And then from then on, we realized how important it was, even not for us, but just for Quentin. If something is in charge, is like the suction machine, the feeding bag, those are very important things that he kind of lives off, kind of required. So we knew, okay, we have to make this investment if we are not going to evacuate, to have the home ready, not just for us, but importantly for him. Yeah. So we did having to get a generator and just be prepared. Yeah.
And you mentioned too, maybe having family or a friend that has a generator that might be willing to let you guys stay with them in a case of.
Yeah. every time hurricane season comes around, I contact all my closest friends and I tell them they all know. I might be crashing at your place if you have a generator in case ours doesn't work, or and always establishing the same relationship every year, touch base with every single one of them, just to tell them, hey, in the event that ours doesn't work or whatever the case may be, can we come stay, at least Quentin and I? So we do establish at least some contacts with people that could help us. The same thing if an emergency arises and the kids have to stay behind, we have people who know, we know that, hey, they'll take care of the girls while I take care of Quentin, or our dad takes care of Quentin. So yeah, we always make sure to do that every year now too.
What a great piece of advice to do that at the very beginning of the season and then repeat every year just to make sure in case anything changes, you guys have your backup plan in place. Which reminds me, a good piece of information too for maybe some pediatricians that are helping their families prepare for hurricane season. Similarly, the Department of Health medical shelters do everything in advance. So once a hurricane or a storm has been declared possibly to hit, the registration for those shelters closes. So registering for shelters, coming up with a backup plan, all of those things are great to do at the very beginning of hurricane season. So I'm glad that you made that point.
Yeah.
And then another question I had for you guys. So of course, the electricity portion of it is always the scary part, especially for a child who's on something like a ventilator, where he's very much dependent. It can be a very dangerous situation if he's unable to have his machinery working. But you guys also had a lot of formula, medications, all of these things that you're filling or getting delivered on a weekly or maybe a monthly basis. So did you guys have to think about stockpiling or having a good supply of these things? And how did you guys go about doing that?
So what I have started doing with him is I keep a whole separate kind of container, that once I know like this time is coming around, I just start putting all of his extra equipment, especially like things that maybe can't get wet. Um, Medication beforehand. I make sure to call the pharmacy, go ahead and get those refills if I can. Same thing with food formula. I make sure to start adding little by little into this. It's called my little emergency Quentin kit, to have, because if anything happens and I can't get access to those special, formula, because some of that formula I can't just buy it over the counter. And especially like you could order it, but who knows when it'll be here. So I definitely always try to keep that emergency container with things in there all the time. And I'm constantly checking it to make sure, going over my little list of things that I need for him. And it's filled and ready and it's by the door and everyone knows where it's at. In the event that we do have to end up leaving, everyone knows where it's at. Just grab that container and we're good to go.
What a great idea. I love that, having that emergency kit ready.
And I also his doctors, like a copy of all of his doctors, and it's in that little in that little bag, and it closes and it doesn't get wet. So
I love it. So an emergency contact list with all of his providers and their contact information. Yes, I think we do recommend to our families to try to have 2 to 4 weeks of supplies, formula, and medications. And like you said, a lot of our medically complex kids are on formulas that are not easily attainable. They're specialized formulas, medications that aren't easily just over the counter. And so in the event of a hurricane, if there is difficulty afterwards with supplies getting into the state or into the city, then it's not just during the hurricane itself, but then maybe a couple weeks after that you want to have enough of these supplies. So I love how you guys prepare with your emergency kit. That's great. So I think that's a lot of the nuts and bolts of preparing for hurricane season, but did you have any advice that you would give someone who was going through their first hurricane season with a medically complex child? Anything that you would have told yourself going back to your first hurricane season about tips, tricks, things to be prepared for, things that maybe you worried about that ended up being okay? Any advice you'd have for new parents going through a hurricane season?
I think the only thing I can say is I know it seems like a lot, because our children are medically complex, but I think if you start now and not wait till last minute and just start preparing everything ahead of time at the beginning of the year, just checking, just like you normally would check for your emergency kit if you didn't have a medically complex child, like batteries, all the things, etc. Make sure you start doing that emergency kit for your child. The last thing you want to do is be caught a few days before this storms are supposed to come, and then you're stressed and you're worried because you don't have some of the equipment or the things that you may need. And I think definitely having a backup family or somebody that in the event that you didn't evacuate, but you find that you do have to evacuate, that maybe you can they can kind of help you because there is a lot of equipment. Some of it might not fit in your car. So maybe have a family that are like, okay, in the event that something happens, would you be willing to travel with us to help us with our other kids or anything like that? So just getting things like that in order for sure.
That's great advice. And then as a parent speaking to your pediatrician or your medical providers, I know we try to help facilitate registration for medical shelters, registration with your electricity company to make sure that you're on the medically fragile list and they come out to help you guys as soon as possible. But is there anything that you would recommend to the pediatricians and providers watching this video that we could do on our end to make hurricane season a less scary or better organized experience for you guys?
Honestly, can't think of anything. You all have been amazing, always informing me, always touching base with me, even before it's even storm season, just to make sure, hey, Diana, a reminder that you have these. So that nice reminder to just let me know, hey, we're here. Did you get things in order? You all have been doing an amazing job with that. So I really can't recommend anything other than just reminding your patients because sometimes we do get a little busy and forget, and it's nice to know that our team is there for us. Yeah.
Well, thank you so much for taking the time to chat with me and
Of
share your
course.
experiences and your 2 hurricane seasons you've been through now. So that has been very helpful, and we so appreciate you taking the time to let us know about Quentin, and we'll
Thank
include some cute
you.
pictures about him. Yeah.
Okay.
All
Thank you
right.
so much.
Thank you.
Bye bye.
Bye.
Hi, my name is Megan Buckner, and I'm a registered nurse manager with Children's Medical Services Health Plan operated by Sunshine Health. And today I will be speaking to you about disaster planning for children with special healthcare needs. Managing a child's healthcare needs and navigating the complexities of the healthcare system can be challenging and stressful. To help children and their caregivers, Children's Medical Services Health Plan, operated by Sunshine Health, on behalf of the Florida Department of Health, offers care management services to every member enrolled in our plan. Our care management team collaborates with each of our members, caregivers, and providers to help identify needs and connect them to resources and services. From helping to schedule appointments, transportation, coordinating referrals, and connecting families to specialized services, our care managers are there to assist in every step of the healthcare journey. Emergency preparedness is a critical component of managing healthcare needs as emergency events and natural disasters can impact health outcomes. Whether our communities are experiencing severe weather, natural disasters, or outbreaks of illness, Children's Medical Services Health Plan assists members and caregivers in the development of an emergency preparedness plan. Not only do we collaborate with the member's caregiver to create this plan, but we also review it throughout the year to ensure it continues to meet the member's current medical needs. Our care managers assist members and caregivers in identifying personalized needs essential to their health and safety during an emergency, as well as educating our families on the importance of having specific plans in place before an emergency occurs. For ventilator, electric, or oxygen-dependent members, Our care managers collaborate with caregivers and providers to identify appropriate locations for evacuation and assist with local emergency shelter registration or hospital sheltering. Additional care management actions include education on maintaining food, water, medical supplies, medications for extended outages, generator safety education, utility and service contact information. Our care managers provide information from our community resource database and emergency resource guide that are available on our website. We also educate families on expanded benefits, including home-delivered meals for disaster preparedness and relief, and flu or pandemic prevention kits. Both printed and electronic copies of the Emergency Preparedness Plan are available to caregivers. During the months of June through November, when weather event threats due to hurricanes are at their peak, care managers discuss these disaster plans with members and caregivers to ensure each family remains vigilant in their planning and preparation efforts for potential emergencies. Prior to hurricane season, specifically between April and May, care managers conduct a discussion of disaster preparedness during routine outreach, especially to all children on life-sustaining or electric-dependent equipment and those receiving private duty nursing. During our outreach, care managers make all efforts to obtain alternate phone numbers and evaluate the child's need for registration for a special needs shelter. If they have electrical, oxygen, chemo, dialysis, methadone, or skilled nursing care needs, the care manager will provide the registration information to the family. Families are directed to floridadisaster.org or their local emergency management agency responsible for the designation and operation of special needs shelters during times of emergency or disaster. Special needs shelters are designed to meet the needs of those that require assistance beyond provided at a general population shelter. They are intended to provide, to the extent possible under emergency conditions, an environment that can sustain an individual's level of health. Registration is required to determine eligibility and the type or level of transportation needed. Families with children that have special electric-powered medical equipment at home are also directed to Florida Power and Light to complete the Medically Essential Service MES application to determine service eligibility. The MES program can help with special notices before and after a hurricane, as well as referrals to social service agencies that provide financial assistance. For any child residing in a skilled nursing facility, statewide inpatient psychiatric program, or specialized therapeutic group care, the care manager will call the facility directly to gather and document the disaster plan. During the storm season, all storm activity is monitored carefully and well in advance. When the governor issues an executive order declaring a state of emergency, the team jumps swiftly into action by cascading critical information such as alerts issued by the state, such as notices about pharmacy and medication refills, to all employees with a special focus on the impacted areas for staff and families that live in those areas. Calls are made to select children and families prior to a predicted storm according to protocol from the Agency for Healthcare Administration, AHCA, and Florida's Department of Health. Upon successful outreach, the care manager will complete a disaster assessment, which prompts a review of the family's primary location, intended evacuation location, electrical or oxygen dependency, skilled nursing care services, medication needs, dialysis, chemo, and/or methadone needs. The care manager will assist with any last-minute needs prior to the storm as best as possible. After a storm or disaster, our care management team resumes outreach to complete another disaster assessment, this time especially focused on post-disaster status. Upon successful outreach, the care manager will document the family's current location and plan to return to the primary location if they needed to evacuate. Other topics addressed are post-storm food insecurities, power status, running water, and medication. If the child is currently displaced, case managers continue working with the family until they return home. If the post-storm outreach attempt is unsuccessful, care managers task themselves to again attempt to reach the family. All outreach attempts and contacts are documented in an electronic medical record. If a caregiver has not answered after 3 attempts, caregivers send an unable to reach letter, but continue to outreach as needed. The goal is 100% confirmation that children and families have returned to their residence. In conclusion, care managers are hard-working and experienced clinicians dedicated to coordinating a medically fragile child's needs throughout the entire continuum of care. One of the most delicate times of need is during an emergency. Care managers across the state of Florida work on decreasing stress at this time by connecting families before emergencies, such as pre-hurricane activities, but especially after the emergency when the need is at its greatest in order to resume day-to-day living. It is through the extensive work of the care manager that provides a resource to families and a level of comfort while navigating through a complex healthcare system during the child's healthcare journey. Thank you so much for your time.
Again, challenges specific to children and youth with special healthcare needs during disasters they may depend on medical technologies, medications, specialized care, and communication. They have limited limitations because there's an amplification of adverse effects of disasters on this population, requiring really a concerted and research-based approach to prepared planning. The needs of children with special health care needs extend beyond their immediate requirements as their physical, psychological, and social factors that affect their overall and long-term resilience in emergencies. And hence, preparing for individuals requires a multifaceted, comprehensive approach, as well as a large support network, including families, schools, local resources, and emergency management agencies. It also necessitates a substantial focus on effective communication, both to prepare for emergencies and to manage the response when disasters do occur. The current status of hurricane preparedness in Florida is somewhat siloed and segmented, and that really isn't. That really is based on the fact that many of the counties have their specific plans in place. However, there's limited information out there and limited opportunities to find the information needed to really provide a holistic view of how hurricane preparedness happens in Florida. Each county seems to have addressed all the issues that come across individually somewhat in somewhat ways. And so this is one of the challenges that we have to face. And so there's a lack of coordination, right? There can be federal agents, it can be national and federal folks coming in, statewide folks, and then county folks. And oftentimes there's a lack of coordination and each one is trying to help. But again, they are somewhat siloed. There may also be some inconsistent information being provided. Occasionally there may be different information provided by different organizations, especially in the beginning. After a storm hits, there's limited connectivity, there's limited opportunities, and so there may be some miscommunication occurring there. There can also be challenges with inequitable resource distribution, as well as an insufficient focus on the most vulnerable populations and groups. And that's why this is so important, what we are doing here today. So hurricane preparedness or disaster preparedness requires a multifaceted approach, meaning multidisciplinary coordinated approach, so that just as many children have many healthcare providers and specialists, each one should be able to provide recommendations for disaster preparedness to help that family prepare for a disaster. Families should develop individualized care plans, right? That's at the family level. And then there's family supports of who in the family, friends, and their network and circle of trust and so forth can help support them, who understands their needs. And then lastly, emergency preparedness. In the case of a disaster or an emergency situation, such individuals may require additional considerations and preparation. A clear understanding of these needs ensures that children are not overlooked in disaster preparedness plans. So let's talk a little bit about let's focus a little bit on electricity dependent medical equipment, right? Children and youth with special health care needs often require medical equipment that requires electricity. Loss of electricity can be life-threatening, so backup power is essential. Shelters for electricity dependent individuals are also essential. And patients and healthcare providers should also should also have a plan for maintaining the device, including keeping extra batteries and supplies and knowing how to manually operate the device if necessary. Some examples of electricity-dependent medical equipment diagnoses includes ventilators, oxygen concentrators, BiPAP and CPAP machines, home dialysis equipment, feeding pumps, insulin pumps, heart pumps, nebulizers, powered wheelchairs, and even refrigerators that help store some of our medications. So this can, individuals who require these equipment may have a variety of diagnoses, such as chronic lung disease, cerebral palsy, asthma, reactive airway disease. They can also have chronic kidney disease, diabetes, and congenital heart disease. These are important to know mainly because it helps you kind of think about, okay, this is a patient with, let's say, cerebral palsy. And so if you can actually screen in your office, right? Just thinking forward a little bit. You can actually screen in your office utilizing the diagnoses codes, what possible equipment this individual would need, and then how best to help them prepare for the hurricane. This is why we're discussing the specific diagnoses today. So where can you begin to help patients in your clinic? Well, first and foremost, remember it's important to prepare your own office, right? Have your office ready for a hurricane. Then you can start helping to prepare your families and your patients. Because if you're worried about your own office during a hurricane or in the days before a hurricane, then there's no possible way that you can actually help someone else or help your patients. So first and foremost, prepare your own office or your own environment. Secondly, then we can start with thinking about staff training, right? Staff training. So help your staff, especially the front desk staff, the ancillary staff, to train them on how to help patients prepare for disasters. Ask your team to compile a list of patients who may have the diagnoses that we just discussed, or who may require assistance, and then make sure their contact information is updated. Months before hurricane season, consider having staff reach out to families and remind them about renewal of medications and medical equipment, and that they should start, having an emergency supply of these items beforehand. Encourage families to devise a written care plan, and we will talk a little bit about this later on. And you can also develop a system for patient tracking and follow-up. This might involve keeping up-to-date contact information for all patients and having a plan for reaching out to them or their caregivers in case of a disaster. This is especially important in the aftermath of a disaster, when it might be, that is often when patients may need the most help. And then work with, advocate for your patients, right? This is a whole nother level, but advocating for your patients with local emergency planning agencies to make sure that their needs are met. And then regularly review and update disaster preparedness plans. This should involve reassessing risks and needs, updating individual emergency plans, retrain staff, and provide updated information to patients and families. One of the key pieces of this whole disaster preparedness strategy is effective communication. That is probably one of the most important areas to focus on. And so it is important not only for the preparedness phase, it's important for the response phase, it's important for the recovery phase. It's also important, it affects the overall success of our mission, and also helps to reduce anxiety among patients and families. So when you use, the language that you use is important. Now, in the last hurricane, I think there were some challenges on the west coast of Florida, because some of the information was not always provided in the language that is most easily understood by the patient. And so we must ensure that such communication is in a way that the patient can understand, it's straightforward, and it's concise. Remember, many of these individuals are individuals with special health care needs. They may already be utilizing communication tools, such as augmentative communication devices, social stories, visual boards, and so forth. Remember to utilize these to help communicate with your families, especially with the individual with special health care needs, because they often are especially anxious. And by utilizing a modality that they understand, it will help relieve their anxiety. Now, communication is always two ways, and so it's important to allow and encourage questions and feedback from families, and being empathetic and reassuring. Consistency of messaging is extremely important, making sure that the messages are accurate, making sure that they're consistent so that everyone is on the same page. This applies to being consistent within your office, being consistent in what each individual in your office is sharing with the families, and being consistent in providing the same message through time. It is also important to provide regular updates, and then when able to help coordinate and help families communicate with other agencies as well. So specific patient and family considerations. So stepping back for a minute, it's important to prepare our families and help them think through this process. So what I recommend is helping them or sort of envision what it would be like to be in their shoes, and what is it that this person would specifically need. So what does this individual who's affected with special health care needs need, as well as the family around them, right? Because oftentimes they may have children in the home, other children in the home as well that may need support, or other elderly in the home and whatnot. And so we have to consider the family as a whole unit. What are the options for families if they choose to evacuate? How will they get there? Who will help them, right? What is evacuation route? What shelter would they go to, right? Which shelter would be able to house them, would be able to have electricity, and so forth. And then what medications, durable medical equipment, a comforting toy, what items does this child need to be able to survive for the next day, 2 days, 3 days, possibly a week, possibly longer? And then what does this family already have in place? What is available through current resources or through the current health plan? And then what is missing, what's lacking? This is kind of how you begin to do a risk assessment based on the type of disaster and based on the type of family that is there. And by doing an in-depth risk assessment, then we can ensure that all the pieces and parts are addressed. So other patient family considerations are that we should consider developing an individualized emergency plan for your family. So really, you should talk to families about doing this on their own. How will you get to a shelter if you have to evacuate? How would you evacuate if you're in a high rise, right, and electricity is out? How would you go and leave that building? Who could help support you? Oftentimes, these families have a lot of equipment to transport. They may have a lot of medications to transport, and other family members. So who can support you in your immediate family, in your network, your neighbors, your friends, and so forth. And then there are something called a health care passport for individuals with difficulties communicating. And what it has is, it's basically a single sheet of paper, oftentimes maybe two, and it has the main diagnoses for the person, their personal identifying information, and then the main diagnoses, their medications, and so forth. And that health passport, it really can be helpful in preparing in providing information to healthcare professionals, emergency personnel in the case of a disaster, and in the case that someone who does not know the patient is not around, or a patient who knows the patient is not around. And then it's important to communicate the plan with the entire family and then practice the plan, right? Actually try and carry it out and see what that looks like. Now, there's also an emergency kit that we should be encouraging our families to put together. That emergency kit should include extra backup batteries. If they do not have a generator, should also include hard to obtain medical equipment such as bag masks, formulas, lines, and so forth. You may also want families to consider having hard to obtain medications in there because those are very challenging in the aftermath of a disaster. And then heating or cooling methods are also important because, again, families will be subject to the environment and whatever is transpiring. Finally, ensure adequate supply for at least 2 weeks of medications would be ideal. Social stories, again, are visual depictions or ways to communicate with individuals with special healthcare needs of what to expect during this time. So social stories tell them a story of what exactly to expect. So first, I'm going to go in the car with my family. We're going to go to this big place called the shelter. There will be many other people there. Things like that help prepare individuals with special needs and what to expect. And then lastly, don't ever forget, try and remember that each individual has that item that they like to do, to play with, to do when they have downtime. And so those are what I consider comfort items that would help them cope through such a period. So here are some specific resources for electricity-dependent individuals. And first and foremost, the power supply options, right? It is important, and probably one of the most important take-home points here is to have your families register with Florida Power and Light Medically Essential Service. You can go online, you can follow this link, go online, and they can submit the necessary documentation to have priority when it comes to electricity. There's also a Florida Special Needs Registry. The link is here in blue, and that is also an opportunity to register with the state of Florida, where families are supported through the state if they identify as individuals with special healthcare needs. The Agency for Persons with Disabilities has a significant amount of information and toolkits on their website. So there's a link that's provided here. There are also county-wide resources that are available as well. And so I've listed a few of those here for Broward County. And then lastly, there's also Healthy Children, which provides, again, emergency preparedness strategies. And then FEMA, and the website is provided there specifically for disasters, as well as the disaster supply kit from healthychildren.org. Finally, additional resources to consider are the American Red Cross, CDC, FEMA. All of these provide great resources on disaster preparedness for people with disabilities. There's also ready.gov and the American Academy of Pediatrics, of course, and a number of other organizations, including the World Health Organization. Finally, preparing for disasters, just some final comments. Here's a complex task that requires careful planning, coordination, and a deep understanding of the unique needs of children and youth with special healthcare needs. Healthcare providers have a crucial role in this process. From individual patient care to advocacy and collaboration, with proper planning and preparation, we can truly help this population. I appreciate you taking the time to spend with us today. And if you have any questions or comments, please reach out to me on my email. Thank you so much. Bye-bye.